Thanks as always to our partner, Fortified Health Security. No matter where you're at in your cybersecurity journey, Fortified can help you improve your cybersecurity posture through their 24/7 threat defense services or advisory services delivered through Central Command, a first of its kind platform that simplifies cybersecurity management and provides the visibility you need to mature your program. Learn more at fortifiedhealthsecurity.com.
I'm Bill Russell, creator of This Week Health, where our mission is to transform healthcare one connection at a time. Welcome to Newsday, breaking down the health IT headlines that matter most. Let's jump into the news. All right, it's Newsday, and today we are joined by the intrepid Sarah Richardson, the goofy Drexta Ford. I don't know. I'm just coming up with adjectives, and the man with the most amazing title, Preston Duren of Threat Services with Fortified Health Security. And wow, so I guess today we're going to talk about threats. Are we going to talk about threats today?
Yeah, hopefully some AI threats. That's what most people are interested in. It's fun to talk about, and there's not a whole lot of information. There's a lot of information, just not a whole lot of actionable information, I guess, or backed up information. So hopefully we can have some good conversations around AI and some threats and make a pretty good thing to listen to.
Can we talk about insurance too? There's like how AI is changing the cybersecurity insurance and sort of landscape in those spaces also, since everyone's under financial pressure?
Sure.
All right. Here's what we're going to do. We're going to go over to the This Week Health website. We're going to go to cybersecurity because we now organize everything by topic. We will hit news headlines quickly, and we will get to some of those topics we just talked about. So October 13th, Microsoft warns of payroll pirate scam hijacking employees' paychecks. And they talked about they're essentially using phishing to intercept multi-factor authentication codes. Scammers can gain unauthorized access to HR portals like Workday. This incident underscores the inadequacies of certain MFA methods, prompting a critical need for stronger security measures such as FIDO compliant solutions to protect sensitive employee data. Talk to me about MFA. Is MFA changing? It sounds to me like it needs to change. Like it's, not something we can just put in place and say, oh, we've got MFA. We're good. We're gold.
Years ago, MFA was just starting to get popular. And one of the first ways that a lot of us in healthcare were able to get the buy-in from the business was the e-prescribing of narcotics, right? Of controlled substance. So it kind of required that in certain states. And that was our kind of dipping a toe into it. Say, hey, we've got to do it, right? Let me get, 100 licenses. And then the next year I can renew and buy 5,000 licenses, right? So like that was the first step in. I think that it's pretty much become kind of the de facto standard now, right? Everybody has MFA. The problem is if I ask a client, hey, you have MFA? They're like, absolutely, we have MFA. And I'm like, do you have it for every vendor, every login? They're like, oh, and it's like, that's tricky. And I remember working with certain healthcare, EHRs and things like that. And their support models at the time couldn't really handle, they maybe had 200 support guys. They couldn't really handle, we didn't know how to deal with that, right? So it's kind of excluded. And so you got to have kind of workarounds and things like that. I think now people are starting to get more used to it. And it's like, hey, look, for cyber insurance, for different things, we've got to have this. We require this in our network. And so people are getting a little bit more on board with it now.
Well, the friction. So Drex, I want to talk to you about the friction a little bit. So the friction of MFA has always been sort of the downside of it. And, you pull it up, you hit your password, and then you have to do some other crazy thing or some other aspect. But I'm noticing more and more, like with my Apple devices and whatnot, they're attacking that friction. And now, I just do the biometric on my device here, and I don't have to pull up the really cool Authenticator app on my phone and look for the number, which is going to change in about 5 seconds. And I go, oh, crap. And
before I can type it in.
So, that friction has always been a challenge at health systems. What's the fine line? What's the balance?
Yeah, I'm going to today's 2-minute drill, which will be published probably a couple of weeks before this episode comes out, but I'm going to talk about this whole issue too. This payroll pirate issue the reality is, I think MFA, as we have fielded it for the most part today, has become kind of old school, and the bad guys have kind of figured out how to get around it. So they're doing it by like MFA bombing your phone until you just relent and say, okay. Somehow they've gotten your username and password from somewhere else. And once they got the okay, they're in the system. Or They just set up pages that look really legitimate, and they get your username and password, and then they send the authentication request to your phone or your authentication app, and you type in the number, and now they have everything they need. Before that session blows up, they are in the system. So these FIDO compliant, phishing resistant technologies are really kind of like the next version of MFA, and it's passkeys and things like that, which ultimately really makes it easier for the end user too, because now it's something that's sort of in the device or built into the device. They may not even need passwords. They can just go right into the system. And these are things that, you were talking about, like if you've used your fingerprint or you've used Face ID, you've kind of used this kind of technology already. And that's the place I think we have to move to as we go down the road here.
You know what, Sarah, one of the things I want to talk to you about is I was reading this article and then I saw FIDO and I'm like, oh crap, another acronym. Like cybersecurity has its own language, healthcare has its own language, IT has its own language, AI has its own language. It's like, how do we, and I wrote this in my article today, it's like, how do we stay up on all of this stuff? I'm personally getting overwhelmed with the AI stuff, and I'm taking my eye off the ball on the cybersecurity stuff. Like, I don't know how I stay current on all this stuff.
So when you talk about it in terms of, especially when it's new, if we say FIDO or we say fast identity online, and we say 2 in front of it, and we just say to people, it's an open, authentic standard. It enables your passwordless login. It gets a little confusing because you tell people it's using cryptographic keys instead of a password. But if you go back and just say, hey, FIDO is this, and what it actually does is what you're already using. And that's, for example, facial recognition, because it's stored on your device. It eliminates vulnerabilities. It's greater experience. That's the way you can explain it to people in a way that makes them feel safe. You add that with things like some adaptive authentication and zero trust. When you layer it and say this plus this equals this, then people are using it at work. Then they're talking to people about it at home. I always think about, how do I tell the 10-year-old next door? How do I tell my 84-year-old aunt? When both of them understand, then I know that I understand it as well, and I can adapt in that perspective to my audience and make it part of the vernacular, not just something that people are afraid of.
I think the 10-year-old next door might be the one who's explaining this stuff to me in a lot of cases.
There is that.
They're already using it on their Xboxes and other things, like they're already down the road with it. So I think that mostly plain English, mostly non-technical, how do I come up with something that they already know about or use today as a way to explain it, is probably, that's the easiest route.
Well, let me kick off the next article with a little bit of pushback with it to say platforms suck. Okay. So let's just start there, because one of the things that platforms do is they consolidate a lot of stuff and they give a single point of attack for these threat actors. So the next article is major cyber attack targets Cisco, Fortinet, Palo Alto networks devices. I know why we do platforms. I'm saying the thing that really stinks about them is they can target that one thing and get a lot of systems and into a lot of systems and into a lot of systems within that system. I'm curious, like, as we keep going to platforms, are we increasing our exposure or are we decreasing our exposure? Who wants to field that one to start?
I say we ask Preston.
Again, I think that all of the attacks, most of the attacks can be solved by kind of going back to the basics in general, right? I mean, unless you're using a 0-day, and even if you are using a 0-day, a lot of the core foundational things, defense in depth, segmentation, zero trust, as Sarah mentioned, really help. I mean, I think that the more platforms you bring on, the more, in certain ways, you open up your exposure. But at the same time, if you have 50 different platforms, it's much more difficult to manage the cybersecurity of all 50, right? So I think the answer depends on the attack, honestly.
You would rather have fewer platforms,
Yes,
easier to defend than, okay.
Yes, because I can have a guy and I can say, you're the Palo expert or you're the insert thing expert. It's your job to make sure it's configured right, it's matured, it's secured, right? So yes, I think boiling them down is safer.
You and I have talked about this. Sometimes what you see, Preston, from your SOCs are things like a lot of scanning of things like Palo Alto in the days before something bad happens. It's almost like the bad guys are trying to figure out, like, are these platforms vulnerable? Have they put the patches in at all of these organizations? which kind of means they're raring to go. Like
Yeah.
coming right behind that is they have a 0-day all teed up and ready to go, and they're trying to figure out where's the right place to weaponize it. You
Absolutely.
see this stuff all the time?
Yeah, we do. And I mean, I have so many examples, but you don't want to waste a 0-day on, let's be honest, a small rural hospital, right? I mean, you want to use your 0-day against Oracle, right? I mean, there's a news article about, some of the Oracle stuff. And even going back to the MFA conversation, we do IR where the help desk will be outsourced and an attacker will call, reset the MFA device, and then wait till the next shift, right? Or later on where it's a different person on, and then call and reset the password, right? I mean, so like it's a multi-stage attack, and all these attacks are against the human at this point, right? So, I mean, we absolutely, kind of go back to your question, we absolutely see the scanning of these devices and things like that, and they're ready to weaponize. And as soon as an exploit comes out, right, it doesn't take long for it to get weaponized. It's in Metasploit, Core Impact, whatever. And the likelihood that you're going to be patched is probably pretty low. It's hard to take down a firewall in a healthcare environment. So they know, hey, 90% of these, I'm going to be able to just point and click and have exposure there.
The question I want to ask here, because is cybersecurity controls and response going to be the first thing we give over to AI in IT? Like just completely give it over, because the attackers are going to do it. The attackers are going to give it all over to AI and allow, the phone calls will come from a bot, even
they're doing a lot of that today.
Yeah.
Absolutely.
And so their attack speed and their agility is going to get faster and faster. And human in the loop, to me, sounds like a flaw more than a feature in cybersecurity prevention.
Drex and Sarah probably have insights on this too. I don't know that I agree with that because, AI is a really good tool in our tool belt, right? But when you let it operate without the guardrails of a human, right? Even if you give it a specific rules and its prompt, it's been proven it can break out of that. It's been proven it knows when it's being tested and it will obey the rules while it's being tested. And so I think that there should always be, at least for right now, a layer of human on top of that, right? We got to make sure that
I think
we are able to control that.
Your answer is going to be different a year from now.
Probably. And in a year from now, we can talk and it may be different. As of right now, though, it's just so dangerous. I mean, the exfiltration, the everything. I mean, I use the AI tools as an accompaniment, like to help me be faster, things like that. I'm very careful about what I put in it. It used to be data exfiltration as files that attackers are uploading. Now it's turned into, it's really your users copying and pasting data they shouldn't into an LLM. So I definitely think there should be human controls and human intervention before it's completely 100% AI.
Sarah, what are you worried about with AI? What are you worried about from a security and compliance perspective? What are you worried about with AI?
Here's what I think about. I've been using a term recently because I've been talking to some BCDR friends. And for those where we're knocking down acronyms, it's still business continuity, disaster recovery. Is some of the things that are important is disaster resilience, a little bit, the whole engineering of resilience in your organization. And that all came about because literally ask the question, how should you use AI in your cyber defense mechanisms? So to me, remember like when we had to learn the network, I remember, please do not throw Sausage Pizza away, the whole network like stack.
OSI model.
Yes, the OSI model. It's okay, now you add the human or the AI piece. So if I'm going to use AI, even like we do it today, you layer it in, you don't replace it, and you have to have the human, because even if AI can detect something, the human likely has to validate and authorize it, because let's just assume that AI flags something in your system as a threat. You as a human still need to understand why. You still need to go back and engineer that code or that response or that space, because if you just go black box, it's going to get pretty dangerous pretty fast, especially if AI can infiltrate and recommend bad decisions being made. And you have to go back and also authorize that. And then just assume it's going to be targeted. So you set up your sandboxes in a way that says, I know this is going to be a primary target. So you're working with all your partners on this. How are you handling an adversarial attack? What if your platform goes down? How did it make the decision? How do you prevent it from poisoning your models? And how do you make sure that in healthcare specifically, so a lot of our partners are more than just a vertical of healthcare. What additional controls do you have in place? Because the healthcare environment is that much more acute.
I think generally there's like three angles to this, and I think it will change over time, Bill, as you kind of allude to. So it's kind of like this idea of human in the loop, but it's allow all, it's deny all, or it's like, let's go back and see how the AI, how the agent did, right? In the allow all model, this is where you're basically going to say the AI is super well trained in this. And when it makes a recommendation, we're just going to let it take the recommendation. In the denial, it's going to be something that's super, like touchy. And we're going to say, you can make the recommendation, but you can't take the action until the human has actually seen it and told you that it's okay, maybe even interrogated the agent to make sure they're really clear on what's going to happen. And then they let the agent go off. But in both cases, you're going to go back and look at the after effect of what happened when the agent took the action. And this is like having an employee and you go back and look at their work and say, well, it would have been better if you would have been a little bit more to the right or a little bit more to the left. Or they really get good at a particular piece of work they're doing and you shift them from denial to allow all because they're really proficient and really good at that. And I think we start to treat these agents a lot like their employees.
Yeah, I agree with that statement. And then I will say, I think you're all wrong. Mostly just for fun. And here's my experience. So my experience is they came out with Claude 4.5, and Claude 4.5 thinking has a 3% increase in its coding over the previous version of Claude. And you think, how much of a difference does that make? And I'm here to tell you, it makes a massive amount of difference. It is a lot smarter. It can read my entire code base. It can make recommendations I wasn't even looking at. That's how far it's come in a couple of months, to the point where I'm now almost entirely coding with prompts, building out applications with prompts, almost entirely. And I'm sitting there going, oh gosh, I mean, this is one of the best programmers I've ever worked with. It understands the entire code base, and I can give it even more context in it. And actually, I did give it more context. I connected it. It's now my backend developer as well. So it's developing the database and the front end. So it has context of all of that. And I sit there and go, I don't know. I mean, I think, again, no offense to the humans in the loop. And I agree with everything that you guys said. I agree. Sarah, we're going to need transparency. We're going to need to be able to see what these models are doing. We're going to need to be able to intercede in these models. But I think it's going to be more of the allow all with transparency and then come back in. But I also think it's going to be like hiring these agents, and we have to keep coming in and looking at the agents to make sure that they're performing the way we expect them to perform and have those kinds of things. And then quite frankly, I think we have to respond to the attacks. And I think the attacks are going to get more sophisticated, more fast. And I don't think humans are going to be able to keep up.
When you look at the big companies right now who have big security platforms, they are deploying AI agents into those platforms. And the idea is that those agents become super awesome, amazing assistants to the folks that are working in the SOC. They take the load off those humans so that the humans can look at the really complicated attacks that are going on, not all of the automated kind of stuff that can be picked up by an agent and dealt with. And this is why, like you said, agents keep getting smarter. They keep coming out of agent school and they got more and more capabilities. And so you trust them more and more over time. I think that's true. I think that's going to happen. And look at where we are. I mean, what has it been, 3 years since GPT was launched or something? It doesn't seem like it's been that long. And look at where we started and where we are today and how fast things have changed just in the last 6 months. In the last 2 months, like it's gonna keep spiraling like that.
But I'm going to go back to, let's just say you've got 20 somethings coming out of whatever schools, certifications, colleges, whatever. If I have their baseline education and I say AI is a component of how we stay secure, I'm still going to want them to understand good patch management, access controls, have to go through training, have to have incident response, have to test your darn backups. No, we're not swapping tapes out in the basement anymore, but still, how often are you recovering? And then the whole macro-segmentation aspect, like all the fundamentals will always be true. And if you don't know how to still do them, manually or otherwise, then you're going to forget how AI is building upon all of those. So that plumbing and engineering, to me, is still really key and something that I will always keep at the forefront of the conversation, because if you don't know those things, how the heck are you going to add technology on there that's supposed to keep those things safe as well?
Just to kind of piggyback off that, one of the
I'm gonna
risks that
hire
I don't
Preston. That's what I'm going to do. I'm going to have Preston.
well, one of the things I don't hear people talk about. So you talk about microsegmentation and we've always kind of known like, hey, principle of least privilege, right? Give people just the access they need, right? And if I give you 20,000 spreadsheets, you can probably look at that and make some determinations. But what I don't hear people talking about is the risk of what AI is able to infer correctly based on the data that it maybe should have access to. That's a dangerous thing, right? So when you're taking that leap from what it has access to versus being able to infer end goals or, data, things like that. I mean, I think that's big, step forward. And that's a place that, I don't think anybody really understands how to do AI securely right now. It's happening too fast. And for healthcare companies, I mean, if you don't adopt AI, you're going to get left behind. So you have to adopt AI, right? But how do we secure against that?
Preston, number one cause of cyber events at healthcare organizations is
probably third party.
Human error.
Phishing.
Human error.
Oh,
Probably
Phishing,
tied to third parties, though.
yeah, but then
A lot of it's time.
risk is right there, Bill.
No,
Absolutely.
third parties is an easy way to get around it. It's human error. It's human
for sure.
It's human error in configuration. It's human error in fill in the blank. It's human error. And so that's my case for this. And by the way, you're all very nice people. And so likes people, Drex likes people. My job is to push people and to say,
absolutely,
hey, change your skills. Your skill is going to be driving the AI machine that is going to be doing cybersecurity in 2 years. All right. So what skills do you need today to really understand what that's going to take? And Preston, what are you going to say to somebody the first time they come to you and say, hey, we're thinking of turning over the keys to AI. Like we want to turn on the allow all, as Drex said, and let it start responding to these events. You're probably going to say, okay, caution.
Again, I think it depends on the situation. I think that understanding the rules of engagement, like, when you say turn over the keys, I mean, that means a lot of different things. And so understanding like what are the potential risks, and then do you have mitigations for those? Do you have ways to detect if it is starting to go the wrong way, right, before the rest of the world knows or before you get user complaints, things like that? I mean, ultimately, I think that AI is a really good thing, but I think you have to adopt it thoughtfully, right? You have to understand like what are the actual risks, and then like what can we do to minimize these risks? Because I don't think not using AI is an option, and I don't think anybody on this call thinks that's an option.
Mm-hmm.
Yeah. Let's turn to money. Sarah brought it up. She usually brings it up in our conversations. Apple boosts bug bounty to $5 million for critical exploit discoveries. I found that really $5 million for a critical exploit. Are we going to start to see, I don't know, health systems do this and others do this? Like, hey, try to hack into our system and we'll give you 100 grand, 200 grand, 500 grand for, are we seeing this already? Drex, I'm curious, are we seeing this already?
I mean, I think you see pen testing at health systems. Health systems are paying companies like Fortified to come and actually try to break into their systems. The really interesting thing to me is that there's a website where a lot of these bugs are listed and reported, and then the bounty hunters get paid out based on the bug that they upload. And the top bug bounty hunter right now is an AI. It is basically an AI that is being leveraged against all the different kinds of applications and platforms, and it's finding more bugs and reporting more legitimate bugs than any human ever has, which is kind of really an interesting, strange scenario that we have here. Like, it makes me wonder for companies like Apple who are offering, $5 million. Now they're offering $5 million for like the very worst possible bug that you could find that's in the top category of like, you could wipe out Apple. But that's the way I think a lot of those companies get people to come in and hammer them with white hats on, as opposed to, the bad guys coming in and trying to take advantage of it. So you're hoping the white hat folks are ahead of the black hats.
Yeah. Man,
I want the hack back attack. And so what I mean by that, so when I see health systems get attacked, ransomware as an example, to me, that's human warfare. It's actually illegal. We as a country don't go and attack back from a government perspective. Yet, what if you're a healthcare system? So we talk about 229 Health System and our HCSP program. What if we get attacked, we get ransomware, and we say, we're not only not paying it, we're going after you. And you have a partner who can hack back and go after them. Drex is like, absolutely not.
Yeah.
There's another side of it that's like, what happens if you go after the bad guys?
I like it, Sarah. Let's do it.
I think it sounds good.
It only
an
takes one health
idea.
system to go after it. And these are like ninja guys. These are the people you don't talk about. These are the real hoodie guys. What if you did hack back and there was some kind of a secret, my secret handshakes usually get me into bars, not into like hacking the other people.
So
But
Preston
think about
Duren
that.
and I are like, yeah, let's go after him. What are you going to tell us?
These two were like, no, don't
No,
do it.
I love the idea on paper. It sounds fun. I think we may underestimate the level of spite and ego in some of these attack groups, and they have an unlimited amount of time to just make you pay for that sin. Drex, I'm interested to hear what you think about
No,
that.
first of all, I think it's technically illegal for you to actually go hack back on somebody else. Now, you can hack back, and you see
Yeah,
companies like
Sarah,
Microsoft.
Sarah and I know people. So
I,
We know
well, I
people.
know, and that's what I'm saying. There's companies like Microsoft and the CrowdStrike. There are others too that do hack back. They do it with the approval of the U.S. government. It usually is tied to some kind of theft of intellectual property, and they allow those companies to take particular steps to try to protect themselves and their intellectual property. What you kind of don't know is that there is an underground in the US government. There is, information warfare aggressor squadrons and, organizations that exist in the government who do watch these hacks and do hack back. And that's where you see things like, server farms are taken down, and there's all kinds of things that happen with other governments around the world. Arrests are made. A lot of those things are happening. It's not publicly talked about until the result flashes up on the screen.
let's close with cyber insurance. I think it was a good call out from Sarah early on, and we'll close with it. We've seen this sort of morphing over because the prices went up so high and the requirements were so specific. Essentially, what you're seeing is that the health systems have come up with different ways to approach this. They're looking for very specific things. They're implementing certain controls. They're potentially doing different kinds of insurance to cover this. I'm curious what you guys are seeing. Preston, I'll start with you, Drex, then come to you. I would love to hear what you guys are thinking.
Yeah, I think that after talking to all of our, clients, you hit the nail on the head. Is the requirements are coming more and more strict, and the cost is, while the requirements are more strict, the cost isn't going down. The cost is just, it continues to escalate. And we've started to see people kind of self-insure and say, look, I can run the math and say, put X amount of aside and it's cheaper. Because even if you look at, I asked a lot of our clients, what determines your SLAs for patching? Criticals in 15 days or whatever. And almost every single one of them said our cyber insurance company. And I'm thinking in my head, that's interesting because I'm looking at your vulnerability data and you are not even coming close to those SLAs. So what does that mean if something happens? The cyber insurance company is going to look at that and be like, I'm not paying you out, but you've been paying all these high premiums. I think it's a dangerous game, honestly.
I'm with you. I think it's the challenge is that insurance companies are really good at writing insurance policies. And so they're really good at putting a lot of exceptions in that if you don't do these things, then we're not going to pay you. And so there's a lot of escape routes and escape clauses in these insurance policies. And I would say you really need an expert to kind of look at these things and make sure that you're covered like you think.
If you're not going to comply, there's no reason to pay the money because you're not going to get paid out at the end of the day anyway. And we saw actually that self-insured came up a bunch. They're going for different types of policies now, which is like a business continuity policy, cyber insurance policy. It's been interesting to see that change. Although I would imagine that same kind of requirements still apply.
Yeah,
They do. Go
they
ahead.
still require proof of the controls you need in place. We talked about MFA, disaster recovery, incident response. All of it, security training, all of that still has to be shown as proof for insurability. But then you start having this, I think, two-tiered system where if you have the resources, you can afford your security controls and your insurance because you can't get insurance unless you have those in place. But smaller organizations are the ones that might go for the self-insured or even lower level policies because you can say, hey, these are required for insurability. But if you don't have the cash flow, it doesn't really matter.
There's also this sort of odd situation sometimes that happens is that when you're insured and you have an incident and you contact the insurance carrier, comes in with their own team and tries to take over the event. Now, sometimes the cheapest route out for them is to pay off the bad guy. and move on with it. It's cheaper than being down for 45 days or 60 days and figuring out now you got to pay all this other stuff to the health system. It's like,
Yeah,
no, we're just going to pay them off.
What
right?
Rick is saying right now does not necessarily reflect the views of This Week Health.
I was about to make the same point, Drex. That's literally was the next thing out of my mouth is like, we deal with IR all the time, and the insurance company instantly wants to bring in their IR people. I'm not saying it's right or wrong, but it makes you think, is that, it's
and they have their own motives. I mean,
exercise.
follow the money. They're driven by the money. And some great insurance companies out there, some great IR companies that are affiliated with those insurance companies. I don't want somebody coming in and taking over this whole event. Yeah.
Well, Preston, we'll have to have you back on. This was a fun conversation, and we'll start with pay the ransom, don't pay the ransom.
Hack back.
Hack back.
I love the spirit of hackback. Look, I'm bought in on the spirit of hackback. Like I'm bought in on the spirit of it. I'll say that.
Human warfare, Preston. We got.
That's right. That's right.
Preston, thanks for being here. Drex and Sarah, always great, and look forward to the next time. That's Newsday. Stay informed between episodes with our daily insights email. And remember, every healthcare leader needs a community they can lean on and learn from. Subscribe at thisweekhealth.com/subscribe. Thanks for listening. That's all for now.